Both in aortic valve disease and aortic arch disease, the left ventricle undergoes pathologic changes, which are characterized by increase in the muscle and reduction in its function. After surgery, these abnormalities are removed, but the left ventricle needs to recover from these abnormalities that occur during the disease. How much will the left ventricle improve, and if it will go back to its normal condition is not known.
In CardioProof, we developed methodology or technology to build electro-anatomical models of a patient's heart. To explain how that works is basically we take clinical images which we binarize to extract anatomical information. That anatomical information matches exactly the patient's anatomy in great anatomical detail. We are using then additional clinical data like ECGs and pressure catheters to parameterize such a model to replicate the patient's electrophysiology and the heartbeat of this very specific patient. So once we are happy with the match between model and patient and clinical data, we can use that model to implement various procedures as they are planned for the intervention, to play out various scenarios and to better inform clinical decision.
Hello. Our contribution to the CardioProof project is about the simulation of the ejection of the blood flow out of the left ventricle. This is very challenging to do this numerically because of the complex and deforming geometry of the heart wall, the opening of the valve, and the presence of the aorta and the network of arteries. So the simulation results comprise the blood flow out of the left ventricle and through the aortic route into the aorta, the pressure field throughout the domain, and also the energy balance.
The models developed in the CardioProof study will help us understand how much the left ventricle will recover, and also to identify patients in which, despite intervention, the left ventricle will still be impaired, abnormality in function will be found. This will help to identify patients at higher risk even after correction of the aortic disease, so to define in advance the follow-up programs for these patients at high risk.